Welcome back. You're listening to the panel discussion, Coronavirus, the Need for a Vaccine Credential, sponsored by MITRE on Federal News Network. I'm your host, Jason Miller. My guests today, Tim Pados, the Vice President and General Manager of Government at IPM, JP Pollock, the founder and chief architect of the Commons Project, and Dr. Jay Schnitzer, the Vice President and Chief Technology Officer and Chief Medical Officer at MITRE. Gentlemen, before break, I made the maybe bad joke about QR codes. We finally found a reason for that. We were talking about the technology that goes into the vaccine credential. But one thing that actually, Jay, you brought up earlier that I think is really important to make sure we hit upon is not everyone's going to have a smartphone. Not everyone will have great access to broadband. Not everyone wants to use their phone this way. So there has to be a way for people who maybe just want to stick with paper to use it. And that paper has got to be secure, because we also talked about the challenge of potentially somebody making fraud documents. So walk me through these equity challenges and how this approach that we're talking about today can address them.
Thanks, Jason. You're exactly right. Equity is really important for this initiative, and we want to make sure that everyone in the US who wishes to can access this capability. They don't have to, but if they want it and they need it, they will have access regardless of their technological prowess, regardless of whether they have a smartphone or some other fancy device or not, regardless of whether they're located in an urban or rural location, regardless of their socioeconomic status, and regardless of their broadband capability. They must have equal and equitable access to this technology across the board. That's one of the requirements for exactly the kinds of things that we're doing, and that's being built in and baked into these applications.
And this is JP. I'd like to pick up on what Jay said and explain a little bit of what we're doing and what we're seeing VCI members doing to get at that. So, first, the ways in which we're asking technology platform vendors and health systems to distribute these vaccination credentials is, first, you can certainly download them to your mobile application, and that mobile application can show the QR code, right? So we've discussed that. I feel like that's what's in most people's minds when we talk about vaccine credentials and health passes. But the other critical requirement is that they're provided with a PDF or printable paper with that exact same QR code on it that can be scanned and verified at locations of choice. And so what we're seeing is EMR providers and pharmacies who are participating are building tools for their providers who are using their systems to be able to access the same kinds of credentials and print those out in the doctor's office or at the pharmacy for folks, so that even if you don't have a printer at home, can log in, and print that out for yourself. You should be able to hopefully be able to get these at various places where you receive care. It's not infeasible that we could see a day when people can walk into the nearest pharmacy, show identification. That pharmacist would be able to look them up in a state registry, pull those records, and be able to print out a document for a person right there. That's a little bit future, but it's not that far-fetched given where all of this is going and how far we've come with getting these standards to coalesce and people to contribute so far.
And in fact, real quick, JP, just building on your idea, through Bluetooth and other types of near-field readers, you could probably send that document from your phone to a printer at a pharmacy just as easily as you described it, as long as you could show two forms of ID, right? The credential on your credential, maybe not on your phone because you don't have it, but the ability to show your ID in something else, and then you could just go from there with a printer. I realize as I'm describing the near field and Bluetooth, you have to have it on your phone to do that. But my point is, there are ways today that you can go down that path.
Yeah, I think that we'll see a lot of cases where healthcare providers who already have your information, where you already have a relationship and they know who you are, they're going to be able to get access for these records for you, whether you are vaccinated there or not, and be able to provide you with these printouts on site, which is going to be critically important for the equity issues that Jay has been describing.
Sure, and as Tim, I can add, I agree with absolutely everything that Jay and JP just laid out. To embellish on a couple of points, there's when we talk about equity, there's also this concept of accessibility, right? So even for someone who has a laptop or has a mobile phone, how easy is it for them to download the pass? So, I'm in my mid 50s and my parents are elderly, and can my dad my mom get on their iPhone and download it as well. So that's very important from a citizen user experience to make sure that it's infinitely accessible and easy to use. Then there's the concept of equity and inclusion from a geographic point of view, right? So working with some of the Appalachian states, for instance, that don't necessarily have great Wi-Fi or cell phone coverage in some of the rural areas. Even in upstate New York, there's some areas where there isn't great cell phone coverage. So ensuring that you have it local on your phone, or to JP's point, that you can print it out. And then the third piece is absolutely, the administrator of your shot can be, can have access to the system as well, and sitting side by side with you, access the credential and print it out so that you can carry it around. So the technology is infinitely capable. It's coming up with the policy and the governance of who can actually, print out the pass.
Tim, I think you bring up an important point here, the policy and the governance side, and that ensures that people obviously understand that it has to be transparent, and people have to understand how the process works. And okay, who's going to have my data? Oh, I will only have my data, or someone who I approve to have my data, like my doctor or my healthcare provider. Is that how is this the vaccine credential project, how the work that you all are doing addressing those big challenges?
Well, the good news is there's companies like MITRE and folks like Jay who are really helping us drive some of the processes and the interoperability standards, et cetera. The VCI initiative helps out a great deal with that as well. And then, each of the state governments that we are working with and over in Europe have, policy teams to kind of meld to address some of these issues. And then the key piece is ensuring that whatever policy, and this is where IBM spends a lot of our time, whatever policies are set, that we can actually bake that into the technology, because that sets the guardrails and the rules state by state and authorized issuer by authorized issuer of what you need to embed into the actual interoperability layer in the application, and ensure that whatever rules that state sets, that it satisfies the verifier. So if I go from New York to Hawaii, ensuring that Hawaii will recognize that, yep, New York's rules about how they're issuing this credential are thumbs up from us, we will accept that as an authorized credential.
And Jason, Tim makes exactly the right points, but many people still worry about, how do I keep control of this? And is somebody else watching over all this and controlling it for me? Or is somebody telling me this is what I have to do and I don't have freedom of choice? And so our response is, this is all about freedom of choice. Each individual gets to decide whether they want to use the credential or not, and whether or not they want to participate in the activities which going forward are going to require it. But this is healthcare information, basically, and it gets protected and treated just like every other bit of your healthcare information, just as Tim described. And that guarantees that it will be secure, safe, preserve the privacy, preserve the confidential nature of it, and be under each individual's control as to who they want to share it with or not, and whether or not they want to share it. And that's not up to anybody else except the individual. And it's completely the individual's choice. They can decide, each of us can decide whether or not we want to do this. And if we don't want to do it, we don't have to.
I think that's a key piece that you said, Jay, because a lot of people believe this will be some sort of government mandate, and the government, I think, as you said earlier on, purposefully maybe decided not to get involved in that scene, that it's very much a third rail, a slippery slope, whatever analogy you want to use. So the benefits of using something like this, and it goes down to privacy a little bit too, is privacy is being built in. There's an understanding that the security is being built in because of that freedom of choice, because you want people to be comfortable to voluntarily use a vaccine credential to then potentially gain access to, again, sporting events, concerts, and the like.
Yes, that's exactly right. And the decision about whether or not to require this kind of credential will be made at the level of the organization that's organizing the activity. So whether it's a part of the travel industry, a cruise ship or cruise line, or the airplane industry or international travel, or whether it's entertainment of one sort or another, or colleges and universities, which by the way are already requiring, and the numbers growing day over day, requiring that students, faculty, and staff returning to campus in the fall must have evidence of complete vaccination. These organizations are making those decisions. That's where the decisions need to be made, not by the government, not by us, but by those organizations. But if somebody chooses then to use one of those opportunities to go back to college, to take a cruise, whatever it is, that's your choice. You can choose not to, of course, but if you choose to, you will need a credential. We're trying to make sure that the credential you have access to is safe, secure, maintains your privacy, and meets all these other requirements that we've just talked about, and is available to all.
Yeah, this is Tim, and I would just add to that, or said another way, it is a good thing in my point of view, and I would assume that Jason and JP agree, that the government is not mandating this. Matter of fact, we don't want them to. We want this to be voluntary. We want the resident or the recipient of the credential to decide whether they want to participate or not. And we want them to decide what data they want to show to which person at what time, right? So this puts the power of having the credential in the hands of having that information in the hands of the resident. If you compare a digital credential to the CDC card, which we've talked a little bit about, there's actually more personal information on the CDC card than I would necessarily care to share, right? On a digital credential, all you have is your name, a QR code, and a check mark. That is all the verifier needs to know. On that check mark, they don't even need to know, to JP's point that he made earlier, they don't need to know whether I was vaccinated or not, or if it is a testing that I've just been tested within the last 72 hours. All they see is the check mark. That is it.
Tim, let me put a finer point on this because we've talked about this several times. The QR code will be used to demonstrate that this is authentic, that this is verifiable. And the way the QR code does that is, maybe can you just take us to the next level down?
Well, sure. So the information, again, going back to how the system works, there's the issuer. I'm the resident. I download my wallet. I ask for a credential. The issuer asks me some challenge questions that only I'm going to know the answer to. New York has gone with 3, which is what vaccine or test did you get? What date did you get it on? And what city did you get it in? Right? And based on that information, you could ask additional questions. Different states can ask additional questions. But then based on that, they issue the credential. That credential lives on my phone. I'm now disconnected from the issuer. When I go to verify, now, first off, a verifier could just be someone at a bar. I want to get into a sports bar, say. The verifier might just look at the credential on my phone, that I showed, say, yep, that looks legit. It's got the New York seal on it. That's good enough for me. An airline or a cruise line might want to authenticate that that's actually a legitimate credential. Okay, so they zap it. What's happening is the verifier has the de-encryption key for that QR code. It de-encrypts and asks, is this an authentic credential? And they either get a green check mark or a red X, right? That's all that's happening. So the next layer down is just matching keys that the health pass holds on the phone and that the verifier knows how to read. That's it.
I think that's a great explanation. Matching keys, right? So does your key fit into my lock, so to speak, or vice versa? It does, you're good to go. Versus it's, as we've talked about, it's not checking some database somewhere that lives to say Tim is Tim and Tim has gotten the credential on this date, this time. So I think, and that's, go ahead.
Yeah, correct. I mean, it's not calling home back to the database in the sky, which again leaves that breadcrumb trail. And it's not asking, when was he vaccinated? What vaccination or what test did he get, et cetera, what the dates are. All it's saying is that, is this authentic? And it says, yes, it's authentic, or no, it's not. If the keys don't match, if the key doesn't go in the lock, then something's amiss.
Right. And JP, jump in here because this also works the same way for paper. You have that QR code on that piece of paper. We talked about equity at the beginning of the segment. It works the same way. It's because that's the beauty of the QR code, if you will.
Yeah, exactly. So the one way to break this down is to think about the CDC card that we've been talking about and what happens when you show up and present that to someone, right? So, I want to get my Krispy Kreme donut. I show up with my CDC card. Somebody looks at it, they make a judgment on it. I put it back in my pocket and I'm on my way. Maybe I showed them some information I otherwise wouldn't have, but it didn't get entered into a database anywhere. No one recorded that info. I wasn't tracked, right? But it also, as we pointed out earlier, could have been photoshopped 20 minutes before in my apartment and printed out on a piece of cardstock, right? So no verifiability, but also no traceability. As we talk about these vaccine credentials, health passes, and the like, now we've introduced a digital layer, so we have to be a little bit more careful because when you have digitized information, it does start to offer the ability for tracking. So while it's more verifiable by scanning that QR code, as Tim described, we have to just take a little bit more caution about what information is contained in this packet, because when someone scans that QR code, as a person who's getting my piece of paper scanned, I don't know if they're recording that information. I don't know if Krispy Kreme is now creating a database of customers who have been vaccinated, right? We don't know. And so as people who are generating these credentials on behalf of people, we have to be cautious about what information we put in there so we're not helping others to create a giant tracking database. Now, I have no reason to believe that Krispy Kreme is doing this, but as a consumer and as a person who's visiting various establishments, I would like not to be spending my time thinking about whether or not they're going to be able to be pulling all of this information off of the piece of paper that I hold up when I walk in or my smartphone.
Maybe they're just creating the database of whether you like glazed donuts or Boston cream donuts or the like. I'd be okay with that personally. Let's take a quick break. When we can come back, we'll continue our conversation. You're listening to the panel discussion, Coronavirus, the need for a vaccine credential, sponsored by MITRE on Federal News Network.